Hi, everyone. This is Roslyn Liu from the State Program Office. It's just about 9 o'clock, and I want to do a sound check to make sure people can hear me. So if you're able to hear me, if you could raise your hand and let me know, great. And if at any point it sounds like it's a little hard to hear me or anybody else, please feel free to write that into the chat box and we can try to work on the sound. So it sounds like people are able to hear me. Great. So welcome to our spring school-based health center coordinators meeting. I'm sure many of you, like myself, are in a house with your family, your pets, other noises. So I just want to recognize that I understand that we're all attempting our new way of doing business and acknowledge and apologize for any of the technical challenges that we may have today. Typically, as you all may or may not be aware, that my team, we're all in the same room when we do these webinars. But today, we're all working from our homes. So therefore, there may be some clunkiness, and we're gonna do our best. And if connection happens to go down, we have backup plans of the person. Loretta is the one that's running it, and we have some backup plans. So if connection goes down, please give a minute and then rejoin, and hopefully everything will get back to normal. We will be posting the slides and the meeting is recorded today. So we'll post the slides and the recording to our website, and we'll send an email out when that gets posted so everyone will have that information. There's a lot of information that's going to be shared today around trying to adapt to the changes that is happening now and a lot of the unknowns. So we will also send a follow-up email with the details regarding any certification changes that are coming out due to COVID. So if there's something that maybe you didn't catch today or there's not enough detail on the slides, we'll be sending out a follow-up email so people know. There we go. First task was try to figure out how to advance my slide. So I just want to first recognize and thank people. The State Program Office wants to recognize and thank the people from the field that I know are doing work that's above and beyond your normal day jobs. I have many people on my team that are working on the incident management structure with the COVID response work. And I know that with this work, that means that people are doing duties that they typically don't do and having to cover for a lot of people. And I know that's true in our program, and I know that's true out in the field. So I just want to thank everyone for their patience and all the hard work, and recognize that this is not an easy time for us. So I appreciate all the work and particularly the responsiveness to our program. I also want to remind people that because we're taking on jobs and duties that pull us away from the program work, that the best way to reach us is to email the State Program Office. So if you have any questions, you can definitely reach out to your nurse or the data people on our team, but I always recommend you CC or directly email the State Program Office email. That email is monitored by everyone on the team, so it will definitely get addressed and responded to the best and probably the fastest way. And that email is at the end of the slides, and most people have it. That's how our correspondence mostly goes out too. Okay, some good news. We were able to dodge the hiring freeze that Oregon Health Authority has put in place and welcome our new school mental health specialist, Micah Rotman. is a social worker, and he's taking on the school mental health specialist that Kate O'Donnell, that position that Kate was in before. Micah's first day was yesterday, and you can imagine what it looks like to be virtually onboarded in this new world. So we're working on getting, he does have email, we're working on getting his email up and going and getting him onboarded and familiar with the program. Micah is local to Portland, and he was a provider working with young people. So he's very familiar, I think, with the work that we do around supporting mental health with young people. So we're so excited. Mike is going to be coordinating the mental health expansion grant, so that includes the capacity grants and the YAC grants that are out. And as he becomes more familiar at some point, he'll be reaching out to grantees to meet all of you. He'll also be involved with the mental health integration work, and at some point we've talked a lot about updating our certification standards to reflect a lot of the mental health and behavioral health focus that we've taken on in the last couple of years, and so Micah will help with that. So again, welcome to Micah, and he should be on the coordinators meeting today listening in. So again, this is day 2 for him, so it's going to be a lot of information, but we're really excited to have him. I think I have a challenge advancing. There we go. Okay. Funding updates. So it's probably not new news to all of you that the state is working on trying to cover some of the budget holes that we're predicting. And I think the governor had just come out with a prediction of being, I think, in the hole for at least $3 billion. So as we've done in the past, agencies are being asked to submit reduction scenarios. So every agency is being asked to submit the reduction scenarios. So we had to go through that exercise for our school-based health center program. And as you know, our school-based health center program is 100% general fund. So it is often the case that we are putting forward cuts during times of recession. But I have to say, some good news is what was submitted for the reductions for the school-based health center program can be absorbed by our program savings. And so if it's based on what was moved forward, we are expecting no impact to the school-based health center system. So again, so we, based on what was put forward for the public health division, as far as reduction scenarios, the school-based health center program plans to absorb that reduction, and we do not anticipate any impact to school-based health centers. There may be some impact as far as travel for our office, some things like cost savings around the coordinators meetings, in-person coordinators meeting, but we do not expect any impact to the field, which is good news. The mental health expansion grant funds are a little different. So the mental health expansion grant funds actually come from a different part of the state. They come, the agency, they come from the public health, the health systems division budget, which is outside of the public health division. So the scenarios that put forward that I was just talking about as part of the public health division, we do not know or have control at this point about the funding that was or is put forward for the health systems division. So that means that I don't know, and I can't share what might be a potential impact to the mental health expansion grant funds. Of course, as soon as we know anything, we'll let the field know if there's any impact. But again, that's a separate division, and every division kind of does their scenarios and shares the information differently, so I don't know anything at this time. The other piece is I just want to, this has already gone out in emails, but the use of the school-based health center fund. So the current school-based health center funding for this biennium or this fiscal year that you're receiving. So agencies that are under program elements or grant agreements. So if you're under a county program element or if you have a contract directly with the state, you are able to use your school-based health center funding for COVID response work if you are closed. Also, the intention at this point is that if you have unspent funds from this fiscal year, so regardless of closure or if you're open with limited services, if you have unspent funds from this fiscal year, we are hoping and planning to have those funds be able to carry over into the next fiscal year. I highlighted the should be able part with the thought that there potentially could have been reduction cuts where that funding could have been lost, but with the recent news, which just came out to us yesterday, that we can absorb based on our savings, I do anticipate that programs, school-based health center programs will be able to roll over any unspent funds into the next fiscal year. So I want to pause there briefly and see if anybody has any questions regarding the funding specifically. So if you have any questions, you can type them into the question box on the side, and we can, and Loretta will read those off so I can get those answered. And just a reminder that you can type into that question box at any point, and we will get to those. There are question break periods throughout the meeting.
Okay, Roslyn, we do have one question. Just want to confirm YAC funds coming from the Mental Health Expansion Grant may not be able to be carried over into fiscal year 21. Is this correct?
It's a good question. So at this point, it's my understanding that the YAC fund, the Mental Health Expansion Grant funds, should be able, if you're unspent, including the YAC funds, you should be able to carry them over into the next fiscal year. The only caveat I have to that is if Health Systems Division had put forward some sort of cut that might include any unspent funds, there's a risk to that. I'm working on trying to get an answer to this, and I've been working on this for a while, and I haven't gotten anything back yet. I'm fairly confident that unspent funds from this fiscal year should be able to be carried over into next fiscal year. I know that's not a clear answer. Anything else, Loretta?
No other questions right now.
Okay. So overall, I think it's really great news. I think this really speaks to a lot of the advocacy work that happens at the state level, that happens at the local level, that people obviously feel the value of school-based health centers and the work that's happening, considering we heavily general funded, but there is a recognition to support the field and not impact the services that are being provided. So I think that's good news. And again, I will try to get information around the Mental Health Expansion Grant funds as soon as I can. I don't know why my slide will not advance. Loretta, will you advance my slide?
Yes.
Thank you. So as most of you are aware, we did some phone calls the last couple weeks. We've been getting requests from internal and external partners asking about school-based health center services and open enclosures of school-based health center services. And so we thought the best way to get that information and get that quickly was to reach out to each of the coordinators and figure out what's happening in the field. And so thank you all so much. We were able to get responses from all of the centers, and the goal is to figure out what services and where services are being provided and how they're being provided. So thank you all for that information, and I just want to share some of the results. All right, I'm just going to let you advance. Thank you.
Not a problem.
So, of our responses, you can see on this slide that 41 of the school-based health centers are providing some level of face-to-face services, and that 73 of the school-based health centers reported having some level of telehealth services available to their school-based health center clients. So it seems like that school-based health center clients are able to access services through either referral or connections or face-to-face with our school-based health centers. Next slide. So as we dive a little deeper into the types of services, so if you look at let's say the first column, so 22 of the school-based health centers reported that they have face-to-face sick care visits available at the school-based health center. And 63 school-based health centers reported having sick care visits available to their school-based health center clients via telehealth. That's great news. And then you can look through the chart, but you can see for the mental health, behavioral health, that 10 school-based health centers are doing face-to-face visits for mental behavioral health. And then 68 of the school-based health centers have mental health visits available to their clients via telehealth. Great. Next slide. And then we also asked the coordinators if you're reaching out to your clients, how are you communicating with your school-based health center clients? And it looks like a majority of them, the ones that are reaching out, are communicating by phone. A good number of sites that have Epic are using MyChart, and then email and then text. So the plan for this is we finalized the interviews just this week, and the plan is to create a document with the types of services that are available face-to-face and telehealth for each of the school-based health centers, share that back out with you and our partners, people who have been asking for the information. We will be providing the contact information for each of the school-based health centers. So anyone interested in specific details of the school-based health centers can reach out directly to you all for more information. The document will reflect that this is obviously a point in time. These are details that are a point in time that we collected, and that information could change. I think we fully also recognize that there could be changes to the information based on summer coming and schools closing, or even the distance learning, and so access may change. Any questions around this information or the use of this document? Again, you can type your questions into the question box now or at any time.
No questions.
Great. Again, thank you all so much. It was a fairly seamless process to get in contact with everyone, and I understand how busy everyone is. I wanted to share some of the information that came out of the office hours. So we held virtual office hours, or the state program office held office hours in March. The intention of the office hours was just to hear from you all, to hear what's coming up, what's working, what's not working, and where are some areas that we could help provide some assistance with. So some of the topics that we heard were that there were some school-based health centers that were open and busy and were triaging non-sick visits through their school-based health centers from their larger system. There was some discussion around the AAP, the American Academy of Pediatric recommendations that had been coming out. I think the recommendations, like all of this, was kind of changing and adapting maybe weekly or daily. And so it's great because we have Julie Schultz, the executive director from the Oregon Pediatric Society, talking next to answer any questions related to that. So that came up as a discussion point. There was some discussion around the use of MyChart during this time. Some school-based health centers found a big benefit, particularly around now, of using MyChart in the Epic system, and then other school-based health centers had some questions or concerns around confidentiality related to the use of MyChart. And then we'll also have someone briefly talking about that today. There were questions around the school-based health center funding or the use of the current funding. And so that information, has gone out in email, and I talked about it earlier, which is that you are able to use the funding, the current funding for COVID response, and hopefully be able to roll that funding over into next year. And then there was some discussion around the collection of school-based health center telehealth data. And I think Loretta is going to talk a little bit about this later, but as you all know, we sent out information around the data that we are collecting, which is what we do every year, which is around the school-based health visits that are being seen in the school-based health centers. And that those are visits that we are that we've always collected. So encounters that are clients coming in face-to-face into the school-based health centers. Obviously, the complication now is that many of those clients are getting services via telehealth, and we don't want to lose that. So, and we want to reflect that we know that either school-based health center clients are getting seen or that school-based health centers are still providing services that may look a little different. And so we've been talking about how do we capture that? And it may be that it looks a little different than the encounter data that we have done in the past. And so Loretta's been doing some thoughts around what that may look like, and then she'll share that a little bit later. So I want to turn it over now to Julie Schultz, who's the executive director at the Oregon Pediatric Society. She's going to be sharing about some of the work that the amazing work and opportunities that they're doing around trainings and presentations and specific opportunities for school-based health centers. So,
excellent. Good morning, everyone. Can you hear me?
Yay! We can hear you, Julie. Yay!
Thank you. Aren't we getting all so good at the Zoom thing, and yet it's still that? Can you hear me? Are you sure I'm there? Hey, everyone. Good morning.
I can hear you, and welcome, Julie. Thank you.
Thank you so much. Pleasure to be here with you. I'll try to be efficient with my time, but I just wanted to say how glad I am to be able to connect with y'all today with the really important work that you're all doing, that we're all doing, right? We're figuring this out as we go along. I have a doctor who uses a phrase that actually I really don't like very much, but I find myself thinking about it a lot. That whole, fixing the airplane while we're flying it kind of metaphor. So here we are. I am the executive director of the Oregon Pediatric Society. I've been with OPS since November of 2015. Some of you might have worked with OPS before. I know that, from looking through the historical record that we were working with school-based health centers on some of our quality improvement learning collaboratives as part of learning cohorts back in 2014. Crater High School, Lapine, Redmond Sisters in Deschutes County, Baker High School, La Clinica, Rainier Health Center. And we've also had a wonderful experience working with Kristen Case from Multnomah County on developing our most recent suicide prevention curriculum. And I'm sure there have been many other groups that we have trained or people from representing school-based health centers who come to our trainings, whether it's in person, which was pretty much most of the way that we did our trainings for about 10, 12 years, and maybe more recently in the last couple of years, webinars that we've been providing. And I'll tell you a little bit more about that. In fact, I think right now we're talking to Alicia Southwick in Umatilla County about doing a depression training, in-person depression training at Pendleton School-Based Health Center. So what I wanted to say off the top is something that I wanted to reinforce that I just heard when I came on a few minutes early. And that is absolutely that the that the message has been changing every week through the pandemic about what we should be doing for children and adolescents as far as care. And I'll just say it really bluntly because we as well are trying to get the word out that, the AAP, the American Academy of Pediatrics, is definitely now emphasizing that people should be, the parents, guardians, caregivers, families should be bringing in their children for well child visits, for chronic care, for acute, of course, care, for mental health, behavioral health issues, for newborn care, adolescent visits. That basically the Bright Futures recommendations should be followed. And they put out a policy statement. You might have seen that. I think it was about April 15th. That basically now is more strongly saying, please, families, keep making sure that your children get care. And what does that look like right now? It's really changed a lot. It's kind of amazing. I mean, it's kind of been warp speed, how we've all adapted, how I'm sure you've all adapted to telemedicine, telehealth. It's been interesting for me working with pediatricians to hear their points of view on that. And I'll tell you what it is it's actually kind of interesting. Some of our older docs are very excited about the telehealth, and some of our early career doctors are not so sure, which is kind of fun. But basically they all say telemedicine is here to stay. And what they're also reporting is that, and this might be your experience as well, that families love it. All in all, families love it. Now, of course, we understand that there are access issues sometimes, and there's some challenges for some families to connect via the phone or via video conferencing. But largely, the families are reporting that they like it. The teenagers love it because they like, if they can have a private visit from their bedroom, they like that. They don't even have to get off their bed. People have been kind of amazed at how successful I think this rollout has been in this widespread way. I'd say that, I remember we've been quizzing our pediatric clinics and providers about what they're seeing. By mid-April, medical visits were down 40 to 80% at some clinics, 40 to 80%. But behavioral health visits, largely through telemedicine, I remember at one clinic in Salem, they said that those visits had increased by 50%. And that's probably, that's just one anecdote, but that's probably a trend that we're seeing. we think that that decline in visits is maybe getting a little bit better again with this messaging, but everybody, of course, in the beginning was very concerned about virus spread and personal protective equipment, and people hadn't figured out all their protocols yet, the providers, but that's changing pretty quick. So again, well child, sick visits, adolescent, newborn vaccines, acute chronic mental health issues, all of those are basically now being encouraged to be followed up with. Now, that might not mean being seen in person. It might be being seen or being treated or listened to, cared for, through some of our virtual tools. But the idea is that people should be getting their checks. Now, you too probably have seen this. This is what I am hearing. There's a lot that can be done through telemedicine. People are kind of astonished, but there's things that can't be done. And I know that in a lot of clinics, they've figured out ways, of course, if they are seeing patients in person, to separate sick from well visits, different satellite locations, different parts of the building, different times of day. They're also doing a lot of the well child visit on by telehealth as much as they can, and then doing kind of parking lot vaccinations or quick stethoscope checks in the parking lot or things like that. So I think what is really the bottom line that we're telling the public through a new kind of public relations, if you will, marketing campaign that we're trying is contact your providers, whether that's school-based health center, whether that's a clinic, whether that's a hospital system, a community clinic, family medicine, pediatrics, what have you. Contact your health provider, hopefully your medical home, and then they will instruct you as to the best way to be cared for. And that's really the bottom line: is call, contact. People have figured out the systems, largely now. I'd say that what the biggest concern is that, along with those drops in visits I was telling you about, of course, well visits went way down. And so have vaccines, and I'm sure you're familiar with that. Vaccine rates have really plummeted, and that is a huge concern, because we don't want people getting preventable diseases during this time. I guess that's the big message. The other thing I wanted to say, and I welcome any questions in the chat box or however you do that. We've got a number of trainings that we're doing. Just this last Friday, in fact, we did a webinar with two child psychiatrists from OHSU and a representative from Lines for Life, that wonderful program, on suicide prevention using telemedicine or telehealth. And it's a 1-hour webinar. Should you care, CME, CEUs are available. It was recorded and will be on the OPS website, as we have other webinars as well on there. On the slide, you see the link there. Feel free to go onto our website and take a look at any of those things if they're relevant or of interest to you. It was a good webinar, because I'll basically tell you what the theme was, even if we didn't hit people over the head. The theme was, you've got this, you can do it, you have to do it. If your primary care right now and your behavioral health, mental health issues are coming to you, you've got to handle it, and especially if it's around suicidality. And so I know when we first started putting our stronger curriculum together a few years ago on suicide prevention, frankly, our primary care providers were nervous. They weren't very confident about handling suicide, whether that was just from a workflow point of view, or feeling like they didn't have enough tools, or they didn't know how to refer. And so that's really been the theme of a lot of our suicide prevention training, is that you can screen, you can assess, you can refer. It could be life and death. It's the most important thing you do. Understand that it might take more time, and people have been really embracing that message. And so that was a little bit of that message too, with the telehealth aspect of our webinar on Friday. You can check it out, like I said, on our website. We've also got other trainings on behavioral health issues. That's a big kind of one of our big project areas that we do at OPS. We also have, and this might not be as relevant to you, but we also have a learning collaborative that's starting this summer. And it's actually through the American Academy of Pediatrics. We're one of 6 chapters of the AAP. Usually a chapter is a state. So Oregon is the OPS is the chapter for Oregon. So there's going to be 6 groups of folks around the country that are going to be working on social determinants of health and adverse childhood experience screening, assessment, prevention, resources, figuring out, a lot of the aspects of how we be more proactive and preventive on social determinants and ACEs. So that learning collaborative is starting in the summer. There is a focus, however, on early childhood, and that's why I'm not sure that all of you would be as interested in that. But if you are, please contact Amber Zuring. Project focuses on ages 0 to 5, and there is, because it's a QI project, there will be some data pools. So folks would need to be able to see enough patients between up to 5 years old to do 10 well child charts a month. So I'll just say that, but it'll be a great social emotional learning experience, I think, for everybody. That's Russell, and I think that's what I have to say right now. Is there anything else that you think you would all want to know about?
Oh, I think that was great to hear. We actually have the state immunizations program presenting today also. So they're going to share a little bit about what they've been hearing and strategies. So I think it's great that you brought up the challenges around the immunizations. If people have questions, you can, for Julie, please feel free to type them into the chat box now. If it's something, we can also, obviously Julie's information is here. We can also connect you later. It's great to have you on today, and I feel like you all have been definitely, I could tell, like scrambling to get a lot of really great webinars and presentations together for the field. So thank you so much.
Oh, you're welcome. And please, everyone, stay safe, and thank you for your very brave service that you're doing right now.
So I don't, Loretta, and you can correct me if I'm wrong, I don't see any questions right now. Give everyone a minute. So if you have any questions for Julie, feel free to type them into the chat box. And Amber and I connect often about trainings and webinars that seem appropriate for school-based health centers, and we try to share those out with the field also. So I think that's worked pretty well. And you guys have been super responsive to all of our questions.
Great. And again, I will say that we, at some point, we will be doing in-person trainings again. That's been kind of the foundation of OPS's work all around the state. In fact, we're usually more often in rural areas than urban areas, although though we go to the metro areas as well. We've done trainings with the tribes. We've been out in Wallowa County and Burns and the coast and you name it. So if you are interested at some point, it might not be this summer, but at some point we will be doing in-person trainings again. And we do have trainings on depression, on SBHC substance abuse, substance use treatment. We've got trainings on, like I said, a number of different things that you can see at the website. And what we do is usually our model is to go into a place and train the whole the whole clinic or the whole staff or the whole entity. And sometimes we go into a community and we invite everybody from the county or around, you know, especially if we don't get out to, for example, Klamath Falls that often. So that's, again, something to ask Amber about if you are interested for your region or your school-based health center for a particular training for your staff. And again, we train front desk, back desk, you know, medical providers, everybody, administrators. So it's something to think about.
Great. So, Julie, thank you so much. And we'll let you know if there's any follow-up. I don't see anything right now, but hopefully people will be reaching out to you individually.
Great.
Thank you.
Thank you. Bye-bye.
So next, I'm going to turn it over to Dr. Tara Roberts. Dr. Roberts is the medical director for the clinics as part of the Virginia Garcia system. So Dr. Roberts, can you hear me? Let's see.
I have her muted, Rosalind.
Yeah.
I wonder if on her side she needs to unmute, like on her phone or on the app. Dr. Roberts, are you there?
Give her a minute. Looks like she has her hand raised. Can you write, it sounds like you can hear us. Can you write into the chat box, Dr. Roberts, if there's something, if we're having some technical challenges?
Oh, Dr. Roberts, it says that you've muted yourself. I'm trying to, I can't unmute you. I think, Dr. Roberts, on your end, you need to hit your little microphone. There we go. Okay. I think you might be, I'm hoping you can talk. Do you want to give it a try? Rosalind, I'm going to make Dr. Roberts a panelist and see if that makes a difference.
Okay.
I don't know if it will, but we're going to give that a try.
Yep. Well, I appreciate people's patience. Again, I said it's going to be a little clunky.
I'm going to send her a message directly.
Well, maybe we could just move over to the certification update, and then we can come back.
Wait a minute, we might have her. I see something changed in her little, okay, so Dr. Roberts, you just need to enter in, there's a PIN number that will allow you to talk. Click to send in. Okay, so Dr. Roberts, if you could type into your phone #231#, I think it will give you the ability to for us to hear you. Now I'm gonna try to unmute. Okay.
Can you hear me?
Yes! Hooray!
There we go.
Okay.
I figured this might be a little bit of a struggle.
Yes.
Oh, it
yes.
worked.
Okay.
Good thing.
Thank you. Go ahead. I'll let you go ahead.
Okay. So I was asked to chat just a little bit about the use of my chart, and I sent just a really brief PowerPoint. There's just a few points that we have here. So I'm not sure how many of our school bases are using Epic, because this is really Epic specific as far as I know for our EMR. And then I sent a PowerPoint that our site specialists came up with for using my chart in the virtual format. I'm not sure how many of our school bases out there have tried the Doximity.me, DoxyMe, Haiku platforms, and if you're having any of the same experiences we are, our agency was not prepared for the bandwidth that would require to have virtual visits go well on our side, and then our patient population struggles as well to have enough bandwidth, internet access to make a virtual visit. So what's worked really better for us is using the MyChart function in the Epic, whether that's in a virtual format, but really working well in the telemedicine format. So again, if I'm speaking and you all know all this, I'm sorry, but we're still all learning here. So this first slide is a screenshot of your Epic when you open it, and on the far right-hand side, it's got an arrow where it says COVID-19 telehealth. If any of you have Epic and you hover on that, and any of those under it, the virtual visit, the telephone visit, the virtual guidelines, it will give you step-by-step, it will give you screenshots of how to use each of those functions within MyChart, and then a question box if you are still struggling with that. So I just wanted to make sure, sometimes Epic changes things and we don't notice the little icons that are up there, what they do. So just using that skill, that hover to discover in Epic, I strongly suggest. And remember, you can't break Epic. You can do anything in Epic 5 different ways, it'll work, and you won't break it. So that's my first piece of advice, is go to your OCHIN and look at your board there and use your COVID-19 telehealth and read those. And then that very first one where it says telehealth glossary table at the very top right under the COVID-19, that'll give you a glossary of terms for telehealth, because we're moved into a space where we're using different terminology to even talk about our visits and what we're doing. So I encourage you to use that. And Loretta, if you could go to the next slide. One of the things that's come up initially with doing the telemed was all the concerns around the HIPAA compliancy, and then the charting part of that, how we're getting HIPAA approval from our patients to be able to do a, quote, telehealth medicine visit. So this is a sample of some language that VG has used, and we've played with it a little bit. This is actually, I don't want to take credit for this, because this is a service area 173. This was in a chart that I found, and we lifted this, and then we added a couple things for us. But this basically covers the nuts and bolts of getting a HIPAA compliance for a telemed visit, and realize HIPAA has relaxed a little of its guidelines. We're doing release of information and approvals over the phone at this point, but like I said, this piece of information put in your chart note when you're doing a MyChart visit can definitely cover you. And if your agency wants to use it and to modify for you, that would be great. We added on ours whether there was interpretive services used at this time, whether they agreed to the interpretive services. So there's just a few more things that we added when we created just a boilerplate of a dot phrase for this. And if there are any questions, please feel free to ask. Next slide. Virtual care. This is a links that we put together because our population is largely Hispanic. So this is a virtual care, and this is reminding you that you can go to these YouTube videos and they will walk you through in Spanish and English how to use MyChart. So some of us are more savvy with YouTube than maybe hovering over our OCHIN and looking over those workflows. This can be sent to your patients' clients as well, so that they know how to use and get set up on their side for their visits. And then include the piece in there for dental as well if you're interested. And then if everybody's doing any group virtual visits, I didn't know if anybody was, but that's on this slide too. I had our EHR department include that in there. And I also included, there was a telemedicine MyChart virtual visits just for virtual visits that I sent that Loretta I sent it this morning, so it can be sent out later if anybody wants that. I don't think it made it into the into this part of the training. Are there any questions I can specifically answer around MyChart usage, how to use it, how it functions in this format at this time from anybody?
Yeah, we do have a question from Ben, and I'm actually going to unmute him, and let's see how it goes. Ben, do you want to?
Are you able to hear me?
Yes, we are. Very good. Go ahead.
Thank you. So we're starting to use the virtual visits in MyChart, and we could provide some feedback on how that really works. But I wanted to make a comment just in case there was some issues with students who are actually going to be staying out of the state during this time for whatever reason, because we know that could be happening. Folks from Northern Portland could be staying in Vancouver or whatever. I know for traditional therapy that if that happens, we're not able to continue services with them because the licensing boards have basically said we cannot do that if we know they're in another state. Do you know if it's going to be different for the school-based health center clients, considering just how unique that situation is and all the other exceptions that come with that?
Hmm.
Is that question directed at me or at Loretta, who's at the state? Because
yes.
I can tell you one of the things that we did
Yes,
was that got praised for HIPAA, we added in the state of Oregon. I don't know for medical visits if it makes a difference. We found that for dental visits for billing, it makes a difference. And don't ask me what the nuances of dental versus medical care are.
Yeah. We've learned that medical visits, it doesn't matter. The boards across the states are fine with that happening. It's specifically for mental health, and it gets really into the weeds depending on what type of license the provider has. Mm-hmm. So we've just been told if we know somebody is in another state to not provide any service. And I'm just wondering if we know that there's an exception for that for the school-based health center. Just because there's a lot of exceptions for those.
Yeah.
Ben, and if you don't know, that's fine. I was just wondering if anybody had an answer to that.
Ben, this is Rosalind from the state. I have not heard of that exception for our school-based health centers, so I'm not aware of one that would be specific to school-based health centers. But that is something that I could definitely ask and follow and try to see if we can get some answers on what that may look like. It definitely seems like that's a barrier during this time. So I can, or if anyone else on the call has any additional information or resources, they can either, chat that in now or feel free to follow up with us or connect to Ben directly. But I can do some digging around that and see. But okay. I don't know of one that's specific to school-based health centers.
Yeah, and I brought it up now because as we're talking about the virtual and phone visits, even if we're doing one of those visits, if the person's out of state, it applies. And I'm just imagining that there might be quite a few students who could wind up out of state next school year if that if it makes sense for whatever reason, more resources there, family members that might be in a more stable situation, things like that. Thank you.
Yep. That's great. Thank you. Loretta, are there other questions?
We did get a comment saying that we've actually struggled to, let me make this bigger so I can read it easier. It sounds like folks are struggling with this also with NP and RN visits, trying to get clear guidance from Oregon State Board of Nursing on the issue. So clarification as possible from Oregon State Board of Nursing would be useful. We've had some kiddos moving around for safety reasons during this time and have been coordinating with our agency. And then I got another statement from a mental health provider, and she said Pacific Source and the provider agency where the child has relocated to ensure the child's safety while they transition to a new provider. And it says we can provide a range of billable and non-billable supports depending on acuity. This is great. Thank you, Elizabeth. I think this is an example of how it'll be helpful, Rosin, when we send out the document that we're working on for services and contact information for folks to be able to reach out to one another.
Yep. Yeah. Thank you. And I'll see if I can find some more answers with this. Dr. Roberts, thank you so much. This was actually, we have about, I think, 2/3 of our school-based health centers might be on Epic, Loretta. Is that right?
Yes. Yes.
So we have a good number. I know that this doesn't apply to everyone, but it came up during office hours, and I think this little taste of what you can do or what you've done and adapted is super helpful And if there's, more interest, I think we could definitely try to figure out how to bring maybe longer or more information to the field.
Yeah.
But thank you so much.
It's a very useful tool, and any of the mental health and primary care that are using it, all of the tools in Epic, like sending out a doc flow to reassess for depression, anxiety, most of those can be sent directly through the MyChart app and come back. Vanderbilt's cannot for attention deficit. That's one we found we've not been able to send, but the rest of those screeners can be sent and come back. And we're also working on our office health assistants and our MAs doing a virtual rooming and then having the patient ready for us so that they are more involved in that too and having more of a touch there with the patient as well. So.
Great, thank you.
Well,
I'm going to move us to our certification updates. And so Rebecca Jacobs from our state program office is going to give some updates. You have to unmute yourself, Rebecca.
Yeah. Hi, good morning. Can you hear me?
Yes.
Yes.
Go ahead.
Oh, perfect. Hey, I will probably be the one with the dog barking in the background. But here we go. So, certification. So, the site visits that we had left over for this year were canceled. And they've been moved to site visits for school year 2021. And we do not plan to schedule any visits in the early fall to allow sites time to get back up and running. And we've been talking about for larger systems. So we usually have a representative sample of about 50% each biennium. And so we are thinking about making that smaller for some of those larger sites moving forward time. And upcoming site visits for the 2021 school year are listed there for Karen and for me. A second to look at that. See if there are any surprises. So, oh, that's fine. So waivers, current waivers, we're changing all due dates to the fall. And new waivers will not be required for staffing, hours of operation, or incomplete samples for the 1920 satisfaction surveys. We are also extending all of the deadlines for action items to October 15th, 2020. You can certainly keep in contact with us and ask questions or follow up as we go along. So I think that was it for certification. Are there any questions?
Yes, there is a question. Will waivers be required for not meeting key performance measures? No, they won't. And I'll be talking about KPMs coming up next. But no, they won't be, we won't require folks to submit waivers for not meeting benchmarks. And then we have another question, Rebecca. So are the fall certification visits, do we have dates set yet? I don't believe
could
we
you
do.
repeat it? For the
Yeah,
site
so are
visits
there, are there dates set yet for the site visits that'll be happening in the fall?
Well, hopefully we won't be doing any in the too early fall. I have not set my site visit dates for next year. Karen, have you?
I do not have the ability to unmute Karen.
Okay.
For some reason.
I don't think, well, Karen, we usually set them really early, like a year in advance, but I have not set mine.
This is Rosalind. I think even if Karen has set them early, I think there's probably a good chance that all those would be altered or flexible, depending on what school is going to look like in the fall. So the idea, or next year at all, completely. But again, as Rebecca said before, the idea is that we wouldn't be having any site visits in the early fall. So you all have more time to adapt to whatever that new normal is for the school setting. Other questions, Loretta?
1 second. Trying to type and read at the same time. Let me remove that one. So then there was a follow-up question. So are we looking in the spring? I think what it is we don't know what the visit dates are going to be. And obviously, just like any other time, we work with the sites to figure out what dates work. I just don't think we have a handle on what's going to be happening in the fall. I think it's really going to be dependent on school starting back up and also what it looks like. Is that correct, Rebecca?
Yeah, definitely. I mean, I think that we will work with the sites and meet their needs about when the best times are going to be for site visits. Given that we don't really know what it's going to look like next year, it's hard to say. But again, I think we'll work with you and figure out how to best do it at the best time. So that's sort of what I'm thinking.
Okay. Anybody have any other questions?
Okay, Loretta, I'm going to turn it over to you now for data requirements.
Excellent. Okay, so I'm going to talk briefly about upcoming data requirements and reporting. And so I'll talk about encounter data, satisfaction surveys, mental health grant report, and then the operational profile and key performance measures. So just like I sent an email out to everybody reminding folks about data requirements and deadlines and covered most of this information, I think, in that email, but I know there are a lot of emails that you all get, so I'm going to go over that now. Our standard encounter data report deadline is July 15th of every year, and we expect to get visits that occurred between July 1st, 2019 and June 30th, 2020. So that hasn't changed. If your site has already closed for this service year and you would like to work on getting your data report together and submit it to me, feel free to do that. I know that's just such an exciting thing for everybody to do, and maybe you want to get it checked off your list. And remember, you'll need to submit that data to me securely. So either you initiated a secure email and submit it, or I can do one and then you can reply to me. And again, it should be data for all visits, primary care, mental, behavioral health, and dental. And it's for all clients seen in the school-based health center. As a reminder, it's not just school-age clients. It's really important that we are able to tell the full picture of all clients that are receiving services at your school-based health centers. As in the past, the data reports only include visits where the client was in the school-based health center. Rosalind talked briefly about this because of the impact that this has on telehealth, telephone, virtual visits that are occurring where the client is not at the school-based health center. And so we wouldn't expect to receive that visit data in your annual report. And in some circumstances, the mental health provider is located in the host school because of maybe space issues in the school-based health center. But those are the only visits that we will expect to receive in that report July 15th. We are working as a team to try to figure out how to collect information about services that are being provided via telemed. And we have a meeting as a team next week. This won't be required data you have to submit to us. I'm going to say that because it's not a typical expectation that you all submit this type of data to us. So it won't be a requirement. It'll be voluntary, but we recognize that there's just so much information we're going to be missing with not having that data submitted to us in the typical fashion with all of the procedure codes, diagnosis codes, patient demographic data, and that. So like I said, we're meeting next week. I think depending on the provider type, it would be less complicated to report just like a total number of visits that happened from when the schools closed down and when a lot of the sites then began shifting to telemed. So for example, mental health providers, it might be easier for them to just calculate how many school-age clients they saw, for example, during that time period that particular person saw. But it gets much more complicated for primary care when a provider is, would normally be seeing clients, say, in the school-based health center as well as the main clinic. Typically, if their schedule is kind of split like that or anything. And we also know that there are providers that have to step in and provide services at the school-based health center periodically. So it's not like they're seeing clients the entire school year. So they wouldn't be, clearly just a school-based health center provider. So like I said, we're really trying to figure out what kind of information, how to collect it. After we meet as a team, I'm going to follow up and reach out to some specific school-based health centers. I want to talk to folks that are in larger systems, folks that are in smaller systems, people that are on Epic with Ocean, and that's where we get our automated monthly data from them. And like Rosalind said, it's about 2/3 of our sites. Sites that aren't on Epic, it's really important because that's where also folks don't often have as much IT support necessarily. So we recognize we don't want to cause a data burden. I think we work really hard to not burden you all with too many additional data requests. And like I said, we recognize this would be voluntary. So stay tuned. And if anybody has any ideas out there about how you all might be able to report to us just the number of visits that occurred that are school-age clients, anything like that, I would really appreciate that. So stay tuned. And so I'm going to go ahead and answer a few questions that we just got. It says, and you get the OCHN data electronically from OCHN, right? So the visit data that we should be getting from OCHN should only be the visits that take place in the school-based health center where the client is located in the school-based health center. We haven't gotten we'll get on May 15th a data extract for visits that occurred the previous month. So I got an April 15th data extract, which I pulled down, and I was looking at visits and the counts and that sort of thing. And we're also looking at that data, comparing last year's OCHN data with this year. And so it'll be really interesting for me to see what occurred between April 16th and May 14th. That's going to, I think, provide a lot more information to us. And that's also kind of why we're not meeting as a team, a school-based health center team, until next week, so I can have a chance to look at that data. And Elizabeth, in Deschutes County Mental Health, so we should not include mental health visits that occur via telehealth. That is correct. In the encounter data report that we receive every year, we would not expect to see telehealth visits in that report. We had sent out an email requesting for Medicaid clients, if you have the ability to attach that UB modifier onto the visit for those telehealth visits that are occurring where the client is, you know, at their home or wherever. If you can attach that, then we can actually, Sarah has the ability to pull a report of Medicaid clients and to look at the UB modifier to help flag and get an idea of visits that are associated with the school-based health center. So let me, I'm trying to read questions and answer and clean up, so bear with me. Okay, here's another question. For encounter data, are we reporting on telehealth visits or only if the client physically came to the school-based health center? So it's only if the client is physically in the school-based health center. That's what should be in our standard encounter data report. That's what we've always requested, is that visits that occur in the school-based health center, that to try to make it a little less complicated. And so that's why we're trying to meet as a team to figure out how to collect some additional information, if at a minimum, total number of visits that occurred during this time period, you know, mid-March through the end of June. So stay tuned, Carissa. You, like most of, so many of the other school-based health centers, most of the visits are via telehealth right now. So we know of the struggle, and that's why we're really trying to figure out how to figure this out, how to collect that information.
Loretta, this is Sarah. Can I just say something real quick?
Yes, please.
Okay, so yeah, I mean, I guess I just want to sort of emphasize that we, as Loretta said, we're really trying to balance we do not want to add additional requirements on top of you. So we are staying consistent with what our requirements have always been, which is visits that occurred in the SBHC. But, you know, for those of you who are willing/able to provide us with more information, and that may not be consistent across the board, and that's okay too. But, you know, I think as we look to our state budget revenue, like, I mean, as Rosalind said, you know, right now we're looking pretty good with our program, but just as we look to our current environment, to be able to show, you know, the role that you all have been playing in this time and being flexible, as well as just, you know, obviously looking at our population and seeing what services have been occurring for our school-age kids. So for those of you who are able to provide more information about those telehealth visits, even if it's summary information, that is really important to us. So I don't want you to hear that we're not thinking about that. We really are. We just are also aware that some folks have really limited capacity in what they're able to provide, and it doesn't feel really fair of us to flip the switch on your requirements.
Thank you, Sarah. I appreciate that. I recognize I was rambling a little bit as I sit here and continue to try to think about how to collect this data. Okay, so satisfaction surveys are always due by July 1st. If it's possible for you all to sync your iPad, so whatever surveys happen to be in there before you shut down, that would be great. It's not a requirement. It's not going to, we're not going to expect anybody to submit waivers if they don't meet their sample size. If you do want to continue administering the survey for visits that occur, obviously, in the school-based health center, feel free to do that for clients ages 12 to 19. But it is not a priority. It's not an expectation from our from our program. And if anybody who had filled out waivers from last school year, so from 2018-19, who didn't make their sample size, those waivers, I'm going to go into the operational profile and resolve them. And because we were not in control of what happened this year, and not fair to keep those waivers open because times have changed. The mental health grant report, like usual, is due on July 15th, and we're working now on the format of that grant report and the content. We're finalizing that as well. Just like we've said, we're trying not to create an additional data burden. There are things that we do need to collect in that grant report, and also just trying to figure out if there's any other interesting information that we want to collect from you all in that grant report, especially right now with how things are and the impact that that's had on you all. So stay tuned. That will be emailed out as soon as we have it finalized. So I know this is far down the road, October 1st, but we have our standard deadline for the operational profile for everything to be entered and updated, like staffing and shift hours, contact information for staff, services provided, those fabulous financial entries for primary care dental as well as mental health. We at this time are maintaining that October 1st deadline, but I hope you hear from us that we recognize that things are really hectic and crazy. We don't know what things are going to be like in the fall. We will work with everybody and be flexible as much as we can around deadlines like this, but we would like to proceed with trying to maintain that October 1st deadline. There's a lot of important information that we collect, and we do audits on the data that you all submit in the operational profile. So it is very important. It helps us keep our contact lists up to date. So we are really aiming to maintain that October 1st deadline. And typically we do a operational profile training the end of summer. And I'm hoping we can maintain that training. The operational profile how-to manual will be slightly updated. I don't even know that there are any modifications that we have. But my goal is for us to still do that training, but again, like everything else, that could change as well. So, but don't worry, you will receive communication from us on that. Key performance measures. So I've gotten emails from folks asking me about the key performance measures. Also, their standard deadline is October 1st. Folks need to audit all types of visits for school-age clients, primary care, mental, behavioral health, and dental. And this is what I want folks to really understand. We only want sites to audit charts for clients who had a visit between July 1st, 2019 and March 16th, 2020. Regardless as to whether or not your school-based health center stayed open, is currently open, we only want audits to take place during the same time frame for all of the sites. So that data at least is comparable amongst sites. And actually it says do not review visits after March 1st, but that should be March 16th. So I will correct that. Somebody had asked if waivers will be needed for if you don't meet the benchmark for a measure. No, they will not be needed. And just like the encounter data, if you are closed and you want to do your audit early, feel free to do those. And I am going to be working on a FAQ on KPMs, just a general reminder of the various things that everybody always has to submit, and then a little bit more information with these details about the dates for which you'll be doing the audit. I had planned on doing a data webinar, but I'm going to do my best to get information out to folks via email. And like any other time, you can always reach out to me directly or send an email to our sbhc.program email, and I will get back to you or somebody else will. So a little bit more detail. I'm not going to read this slide because there's a lot of information. This is the information that I am also going to put in the FAQ. But I will say, just like any other year, we expect you to submit the audit process that you'll go through for when you're reviewing charts. And you'll have to submit that and the audit tracking spreadsheet for when you do the actual audit. Those have to be submitted and reviewed by me before you can enter information into the operational profile. That is no different. I really encourage you to send your audit process document to me first before you do your audit. If I see anything in the audit that doesn't make sense or you might be doing it incorrectly, you will have spent time doing the audit on a process that wasn't correct, and then you'll have to go back and do the audit again. I encourage you to do that. It's not a requirement. And then, like I said, there's additional information here about the audit tracking spreadsheet that we need you to include for why a chart was excluded. And that's where I'm going to go into more details on the FAQ. I'm not going to read all of this. Everybody will be getting a PDF of the PowerPoint presentation, so all of this will be on there, and this will be spelled out. It's a lot of information for me to go over right now, and while I'm a fast talker, my time is about up, and I want to keep us on schedule. So questions, and I did get a question. If we have an existing waiver for the 2018-19 school year for a KPM, how will they be handled? Sarah, have we talked as a team about this? I know we talked as a team about waivers for satisfaction surveys for the previous year, and we were going to just resolve them.
Sorry, Loretta, can you repeat the question? It was about satisfaction surveys for last year?
Yes. So how will we, if we have an existing waiver from the 2018-19 school year for a KPM, how will they be handled?
I mean, I don't remember us talking about this specifically, although maybe we did, but I don't think.
No.
Yeah, I'm not. I mean, we'll have to talk about it, but since we're not going to make you do waivers for this year, I guess I would say we might make a note of it for next year as something to follow up on, but I don't think that we would require you to, we're not going to require you to keep that waiver open for next year.
Right, that was my gut as well, Sarah, but we'll at least have that history in the operational profile. But yeah, I feel like it's similar to the satisfaction surveys and those waivers. And I will put that, we'll be talking about this a little bit more as a team, and I will put it in the FAQ document that I'll be sending out. Okay, so feel free to type in questions and we can get to them later. I am going to unmute Steph and Mallory. 1 second. Mallory is now unmuted. Let me go down and get to Steph. Okay.
Great. Can you hear me?
Yes, we can.
Great. Well, it's really fun to be back here. Mallory and I work in the immunizations program, but I used to work years ago in the school-based health center program. So I'm glad to be able to come back to the coordinators meeting. So we're here to talk a little bit about immunizations during COVID-19. I'm going to start out by talking about a survey that we conducted about, I guess it ended a couple of weeks ago, and what some of the responses are and how they impact school-based health centers, or sort of things you can take away from some of the results. And then Mallory will talk about working with schools on immunizations moving forward. So if you want to go to the next slide. So again, the survey was focused on clinic modifications in response to COVID-19. Next slide. So some of you may have seen this survey come through in your email, and we know that we got responses from school-based health centers. So the purpose of this was to inform the VFC program about changes that clinics were making in response to COVID-19. We were hearing a lot from clinics who were contacting our help desk around what to do with their vaccines, or having questions to us around different ways of modifying their clinic care, and questions of what other folks were doing. So we thought that we would develop a survey somewhat quickly and send it out. So the survey was open for about 2 weeks, and it closed on the 30th of April. And we had a pretty good response rate. Actually, we had about 281 respondents, and they corresponded to even more clinics. In the VFC program in general, we have around 600 VFC clinics, so it was somewhat close to a 50% response rate, which we considered great. Of the respondents, 240 of them were primary care clinics that serve children, either pediatric or both adult and child. Next slide. So almost all of the respondents said that they had modified clinic operations to adapt to coronavirus. So it was around 95%. And of that, here are some of the changes. It's not an exclusive list, but a lot of them, more than half, about 65%, limited well care visits. Many were also prioritizing newborn or infant immunizations. Some, again, more than half, were separating sick and well patients, increasing telemedicine, and then rescheduling teen and older child immunizations. Next slide. 43% changed their immunization workflow due to COVID-19, and we looked at this data. We also received, we had a couple of options within the survey where folks could also put in some of their comments, and we got some really rich data from that. And so we looked at the way that they changed their immunization workflow due to COVID-19 and separated it into kind of 3 categories that I'm going to go through here. So the next slide goes to changes that limit immunization opportunities. So rescheduling immunizations for a later date. So I already mentioned that many clinics were prioritizing immunizations for under 1 or under 2-year-olds. Some had a little bit broader, and they were prioritizing immunizations for those under 5 years old. They were rescheduling immunizations for some clinics for all kids, and then for other clinics for just older children. For some, they were making sure that immunization visits were now scheduled, so it was not possible to do any more walk-in visits specifically for immunizations, only for sick visits. They were rescheduling well visits for patients who didn't need immunizations. So, we were seeing a lot around, and this is going to be totally unsurprising to you in a clinic setting, folks were essentially just trying to limit the number of healthy patients that were in the clinic. So they were rescheduling those visits for later. And then some had just limiting the visits in general. So they were limiting their visits to those that need immunizations in the morning appointments, and then having sick visits in the afternoon. That could potentially have a neutral sort of impact on immunizations, but just the idea of limiting the visits potentially could mean that they were rescheduling for them for later. And then the sort of more drastic one is that they weren't doing immunizations at all. And they were referring patients either to the health department or the nearest SBHC. And 2 things to note around that. One of those things is that currently there is not access via health departments in the metro area to immunizations. So Multnomah County, Washington County, and Clackamas County are not providing immunizations in their health departments in the same way that other counties do. They're doing it through their FQHCs. But if folks are referring patients to the nearest FQHC, you need to ensure that patients, it's best if the clinic has a good idea of what the patient is going to come up against once they go there. And for many FQHCs, they require that patients are established for care, and that requires going through a few steps. It's not like you can just walk in or call and get your immunization done. So next slide, we'll talk a little bit about changes that we sort of viewed as quote unquote neutral. So they would have potentially like a clean room and a sick room for visits. So they would delineate their clinic. Obviously, you need to have a large enough clinic to be able to do that. And I know that a lot of school-based health centers don't have the space for that. Some opened an immunization-specific schedule on certain days. So they decided, you know, Monday, Wednesday, and Friday on the mornings, that was when you could get your immunizations. Other sort of more interesting ones is that they were giving vaccines in parking lots or at the vehicle, or just in the parking lot in general where patients would come up. And the idea, again, behind that is that they were trying to really limit having healthy patients inside the clinic. Others around that same idea, they were limiting wait room occupancy by rooming immediately. So basically, somebody would knock on the door, and then instead of waiting in the waiting room, somebody would come to the outside door and bring you all the way to the room that you're going to see the healthcare provider. So there was no sort of waiting in an area before your visit. Some did their screening questions prior to the visit, so they were doing them via phone, and then they were reviewed with the nurse when they came in for the vaccine. So again, sort of this idea of limiting time that patients are in the clinic. And then some, if they're a part of a system, what they did was they essentially designated one clinic as a sick clinic and other clinics as clean clinics. And so, for example, the person who wrote this in said that school-based health centers in their system were designated as clean clinics and they were immunizing. Next slide. And then here are some changes that we sort of thought of as encouraging or you know, potentially helping to increase immunizations. So some were pulling alerts for immunizations at every single visit, not just well visits. Obviously, the patient has to be healthy enough to receive the immunization, but the idea was that they were sort of capitalizing on having somebody there. They were holding walk-up vaccine clinics and prioritizing well visits for those under 2. Some were hosting drive-through or outdoor vaccine clinics. We were having some folks reported doing outreach to bring well visit appointments into the well sites for vaccine and keeping well visits on schedule as much as possible. Some were offering nursing visits for immunization only or in-home vaccine visits, which I know is not necessarily an option for everyone. And then others were just trying to make sure that they were keeping a record of folks who were going to need immunizations, and then making sure that, you know, once things open up or loosen a little bit, that they could contact those patients and get them in ASAP. And then the last is, again, sending a clinic said that they were sending letters notifying patients that they're due for immunizations and reminding them or letting them know that the clinic is still open for well visits. Because right now is such a sort of strange time, we have seen a huge decrease in immunizations in the past 2 months. It's unclear to us whether or not we are going to see that essentially is just a pause, and then once things open up a little bit, patients and parents are going to feel comfortable bringing their kids back in for immunizations, but it's a little unclear. So if we go to the next slide, think we skipped one.
Nope.
There we go. So thanks. So this is sort of things for you to consider. As I said, we have seen a decrease in immunizations pretty drastically. It was, I think we've seen a 75% decrease since the middle of March until today. We also know that vaccine ordering through the VFC program is also drastically down, which is unsurprising. We know that it's actually difficult once kids get off schedule, that it's sometimes really hard to get them back on schedule. It's so part of the reason that we wanted to collect this information was to think proactively about what we're going to have to do to get those kids caught up. And we know that vaccines are important to protect children from preventable childhood illness. And we also know that patients and parents may be reluctant to access care for the foreseeable future. So we think that school-based health centers may be even more critical, especially for the older child, given that many of the clinics in Oregon have been prioritizing infant care and infant immunizations. A lot of those older children will need to catch up, and so your services may be even more critical as we open back up. And this is not just something that OHA knows. This is just a screen grab from a press release put out by Oregon Pediatric Society, Academy of Family Physicians, the Children's Health Alliance, encouraging parents to keep well visits and normal vaccinations up. So I'm not going to pause there for questions. We can do questions at the end. I want to hand it now over to Mallory with our school law program to talk a little bit about how you can capitalize working with schools regarding immunizations.
Thanks, Steph. Yeah, so school-based health centers may play an even bigger role, and like Stephanie said, particularly with that 7th grade Tdap shot that is always a big issue and gets the most exclusion letters each year. But let's talk about how things work with the schools and their timeline. We'll start with that. So schools collect records in the fall. Some are already starting to collect ones for, the kindergarteners, incoming kindergartners. Then they take those records and they manually enter those into their student information systems. They run reports from their computer systems, and some notify families, most notify families of who, of the students missing shots, but not all. So I want some people, and then they run these reports, they send them to the county health department in January, and those reports in January are what the local health departments use to issue exclusion letters. So sometimes that exclusion letter is the first notice to families that their child is behind on shots. And I wanted to go through this timing because that really will play into how the school-based health center can work with schools. So next slide. So it's really important to know if you want to work closely with a school, what their timeline is. So when does your school plan to do their data entry? Like I said, some have already started, some get on this at the kindergarten roundups in the spring, and some don't start doing their data entry until December. And like I said, that reports in January, and if you are just starting to do data entry then, there's really not a lot of time for parent notification. So how do they notify parents? Some schools send a very specific letter to the family saying, your kid is missing their second MMR shot or their Tdap vaccine. And some just send a general notice to all 7th graders that the Tdap vaccine is due this year. That's really important if you're planning a clinic and you want to get a good response. If there's a more generic letter, you might not get as many people coming as a one addressed to specifically to them or to their child. And when. Last part is really important to know when they notify parents, because if you plan to do a shot clinic, but the school hasn't sent out any notifications yet, you'll have a poor turnout or a better turnout if you can align that really closely with the school's data entry and parent notifications. Next slide. So in the clinic, there's ways to run your, reminder recall using alert and stuff. Schools have their own reports that they can determine who needs shots. And that can be really helpful for planning a shot clinic, because you can say, okay, we've got at this middle school 43 kids that need their Tdap vaccine. That's how much, how much vaccine to order, how much to plan to bring over if you're going to do a clinic, in the parking lot, whatever you're planning. An important thing to remember is that the schools are generally only tracking school-required vaccines. So if a 7th grader has already had a Tdap, but is due for their second HPV shot, that HPV is not a school-required vaccine. That will not come up by the school. The school will not necessarily know, because they don't enter that first HPV shot into their student information system, and there's no report pulling who's due for non-school required shots. So that's really important when you are thinking about shot clinics, to do your own reminder recall or forecasting. If you get a kid in there for a Tdap or whatever, to look at what other shots they may be due for based on the clinical schedule. Next slide. Okay, I was talking to a school a couple weeks ago, and they have a school-based health center really close by, and they were thinking, oh yeah, we should really connect with them and try to get more kids going to that school-based health center. And I thought that was a great idea, and didn't know that they weren't talking more closely already. But the school didn't really know why people weren't going to the school-based health center. So I think I put that somewhat on you to share what you need to the schools. What do you need for the schools to tell parents? Do you need permission? Do you have a permission slip? Do you need billing information? And I didn't know that answer to tell the school, but the more that the front office folks know, or the people doing the immunization reports, or a flyer or something, they can help have those conversations with the parents to get them the access that they need. Thank you.
Okay, so we can answer a few questions if there are any. Yeah, so if you have any questions, please put them into the chat box. I think we have about time for maybe 1 or 2 questions. And the contact information is there for Stephanie and Mallory, so please feel free to reach out to them if your question doesn't get answered today. Thank you both so much. Loretta, any questions?
No questions.
Okay.
Thank you
both so much. And again, these will be posted and their contact information is there, so you can feel free to follow up with them. So I asked Tara Miller from our state program office team to give a brief update on our school health services planning grants. She's coordinating the planning grant process, and so I wanted to make sure that people are aware that these grants are still active and moving forward. And at this point, we are expecting that they would be fully funded moving into the next year also. Tara?
Thanks, Evelyn. Yeah.
Yep.
So I'll be pretty brief here, but as Evelyn said, our school health services planning grants are moving forward. We have 11 grantees who are in the middle of their needs assessment, which was supposed to last from January to June this year. Obviously, activities got a little bit wonky, and some of them postponed or canceled completely due to COVID. And so we are extending the needs assessment timeline a bit and giving folks the opportunity to do some of those activities next year as well. And we're just requiring a progress report from them for the year one activities. And so as, if all 11 grantees choose to move forward, we'll assess that in June, and then they'll all have the opportunity to move forward. And if they choose to, they can continue, like I said, needs assessment activities in year two, and then move on to more like planning and implementation. And that would be toward either a school-based health center or a school nursing model. And the decision is based on the findings from the in-depth needs assessment. So we look forward to kind of seeing where folks land with choosing a model and how they are going to move forward with addressing student health need in their communities. I think that's all.
Great, thank you. I think I just want to share that I feel like we've learned a lot around adding this assessment period to the planning process, as many of you guys have done in the past, and really kind of collaborating and building in that school nursing model discussion. So I think there's a lot to learn from these planning grants. And if you have any questions regarding the planning grants, you can feel free to contact us. I'm going to move us forward to the Oregon School-Based Health Alliance. I want to make sure we give them enough time to walk through their slides. So Lori and Maureen.
Yes, thank you, Rosalind. This is Lori Huffman with the Oregon School-Based Health Alliance. And as you know, we're a nonprofit. Our mission is to strengthen school-based health services and systems that promote the and academic success of young people. And here are our photos. And we can move to the next slide, please. So we wanted to let you know about some upcoming changes. I'm actually going to be moving on from my role. This is something that's been a long time of planning, and I'll be leaving June 12th. And we're really happy that Maureen Hinman, who directs our policy and strategic initiatives, is going to be moving into the interim ED role. And she has deep experience with the organization and brings all kinds of skills to help keep the work that we do stronger than ever. And we'll continue to implement innovative programming that elevates the youth voice, continue our strong advocacy and policy work, and expanding partnerships in health and education sectors. And I'm going to turn it over to Maureen, who will work with the next slide.
All right, thanks. I am excited to continue supporting the field. And one of the ways that we're doing that right now is really by focusing a lot on advocacy. We're trying to be forward thinking, which is something we have to do as advocates, is kind of try to think a little bit past the current moment, which is a real challenge right now. But we also want to make sure that as we're thinking ahead to school opening and to the next year or so, that school-based health centers have the support that you all need to do the work that is going to be really, really critical. So some of the things we've been doing is we've been working with the National School-Based Health Alliance and the other state affiliates to develop a funding proposal. So we're asking for $100 million to be included in the next CARES Act, which is actually being developed basically this week. I think by Friday is the goal to have that completed. And so we've all been lobbying our Congress people to try to get that in there. And that is to make sure that school-based health centers have what they need for potentially beefing up telehealth if that's what is needed, and if there's been revenue loss that is going to make it challenging to reopen, to make sure that there's funding support for that, for things like PPE that is needed. So that's kind of what that one is about. We also are encouraging school district leaders, the Department of Ed, and OHA's, Oregon Health Authority's teams that are doing reopening planning to include school health providers in decision making and planning processes. And in fact, today we're meeting along with the school nurses and the school social workers who we've been working with. We're meeting with one of OHA's planning teams to talk more about the reopening. And then we're also connecting with our partners in California, Washington, and now also Colorado, because you probably have seen there's a Western States Pact among our states about kind of reentry and reopening. And so we thought it might be a good idea for us to collectively advocate for school-based health support. And then we're working kind of more at the community level to partner with and support other human service oriented organizations so that we can all advocate for supports for children and families in the Oregon legislature. So that's some of the work we have been doing. One of the things that we would love to do as we're doing this work is to really understand the needs of the field. And so we are hoping that some of you may be interested in joining an SBHC advisory group to kind of provide us with information about what your experiences are, what you're learning, and especially what your challenges are and concerns about moving forward. So if you are interested in that, I anticipate it's probably not going to be more than a once-a-month meeting, and probably short term. It just kind of depends on how the world is looking. So if you're interested, if you could type in the chat box these things that are on the slide, your name, which SBHC system you're from, your email and your phone number, then the state folks are being kind enough to forward that to us, and we will have that information, and then we'll get in touch and work on scheduling a meeting. So that's all we have for today. If people have questions, let us know. Otherwise, we'd love to have you join our advisory group to help inform our advocacy. Thanks.
Great, thank you,
Maureen.
Lori and Maureen. Any questions?
We do have one question. It says, what are you hearing from the Oregon Department of Education as far as reentry for school-based health centers?
Right now, not very much. I'm hoping to learn more in our afternoon meeting, because I know that they're trying to partner with OHA. So the meeting today, I believe, is with the team that is working with the Department of Ed on a reopening plan. So we're going to be talking about that today and providing some feedback. But as far as if we're reopening or not, I don't think anyone has that information yet.
And then there was a follow-up. Will that be shared in the listening and learning sessions?
Those listening and learning sessions are put on by National School-Based Health Alliance, so it won't be shared on an Oregon level. But I'm trying to think of if like how we can get information out. I mean, we are frequently posting on our social media any information that we get that is kind of pertaining to school reopening and things related to youth impacts and stuff like that. So we'd love if you'd follow our social media. That's one way to find out. Oh, and I just want to mention, we are trying to get the word out that you all are offering services so that people know And that's another thing we've been working on as far as our website. So if there's information you want us to get out, we are happy to do that as well.
Anything else, Loretta?
No, that's all.
Great. Lori and Maureen, thank you so much. And again, if you are interested in joining the advisory committee, please feel free to type in your name, your SBHC system information, and your contact information, and we'll pass that on to the Alliance. It's a lot of information today. And again, everything will be posted. We have email follow-ups that need to go out to people. Feel free to follow up with us or any of the presenters directly with questions or comments that you had that did not get addressed today. I want to just close by talking a little bit about the fall coordinators meeting. So for anyone who hasn't participated, every year we do an in-person fall coordinators meeting, also inviting our mental health contacts. And I don't know what the fall coordinators meeting is going to look like at this point. There's a lot of different pieces obviously in play. It is a lot of people in one room, so there's the physical distancing considerations that would be in effect at that point. I also know that we are probably not the only people under budget restraints of traveling, so I recognize that many people may have limitations in being able to travel or stay in certain hotels or locations, and then there's just comfort level and availability to be able to leave your responsibilities. So considering all of those challenges, we at the State Program Office were considering what the fall coordinators meeting would look like and what are the priorities that we need to cover. So what I'm thinking is that we probably will put out some sort of questionnaire or asking the field on what are the topics that we should be focusing on and the different formats that we would have available to us in the fall. So please keep an eye out for that. And thank you all so much again for your attendance today, all your great questions and your patience. It definitely was a little clunky. And thank you so much to Loretta and Kwong, who are behind the scenes trying to make everything seem as seamless as possible. Again, reach out to us with any questions. We're here, we're available, and I appreciate everyone's time and energy with all of the work. So thank you so much and enjoy your day.